My name is Stuart. I am a student physical therapist at the University of the Pacific. I'm here at Balance Physical Therapy for an 8-week rotation. It's the first out of 3 longer ones, and this is my final week here. So I'm here for my first outpatient physical therapy longer rotation. I've been able to work with 2 different CIs, Brian and Raul. We've been able to, this is the first longer rotation out of a few that we've had. We did a 4-week rotation last summer, and this one is kind of nice because I can have a longer continuation of care with patients, see them for a longer amount of time. Also be able to learn from 2 different guys at the same time. They have both different personalities, different treatment styles with patients, so it's kind of seeing the best of both worlds. So it's a bit of a challenge with 2 guys, but I can learn twice as much as I can in another setting. So that's been really good so far. I've been able to see a lot of different patients, lots of orthopedic conditions. I have a special interest in vestibular rehabilitation, and I've been able to see a couple patients with that as well. So overall, lots of great experience. I feel like I've grown a lot. Still have a long way to go, but off to a good start. I think one of the things that was the biggest surprise for me was kind of the unique clientele that I was able to see here. I worked as an aide in outpatient clinics before, and you kind of see a lot of really similar things, but I've seen a couple patient cases that are a little bit more unique. People with certain neurological conditions, something like post-polio or traumatic brain injury, people with specific nerve palsies that I've never seen before, a lot more vertigo patients, or people with vestibular hypofunction. So those have all been really unique, really interesting. It's been cool to see how my CIs can guide me through treating them and coming up with different interventions. So yeah, it's been really fun seeing a bunch of new things and being able to work hands-on with a bunch of patients that I've never been able to see before. For any future students that might be coming here, I would say ask lots of questions. There's going to be a lot that you don't know. There's still a lot that I don't know. But try to ask as much as you can, not only from your CIs, but from all the other therapists here. They're all great. You can absorb a lot. You'll get a lot of experience, but just don't be afraid to jump in. Don't be afraid to make mistakes. Your CIs are there to be a bit of a safety net. They'll catch you and give you a lot of good advice, and we'll grow through a lot of the little mistakes and failures you make. But yeah, enjoy the time. The patients are awesome. The CIs are great. Everyone on the staff is super helpful, really welcoming environment. So it's been awesome here.